Hey there, and welcome. If you or someone you care about has an amylase test coming up, you've probably got some questions, and that's completely normal. So in this explainer, we're going to walk through everything, step by step. We'll cover what the test is, why it's used, and what the results can tell us, so you can walk away feeling a whole lot more confident about the entire process. So here's what we're going to cover. First, we'll talk about what amylase actually is, your body's little digestive helper. Then, we'll dive into why a doctor might order this test in the first place. After that, we'll get practical and talk about what to expect during the test itself. Then comes the important part, decoding your results. And finally, we'll put it all together to see the bigger picture.
All right, let's kick things off with the star of the show, amylase. What is this stuff and what does it do in our bodies every single day?
Okay, so think of amylase as one of your body's most important workers. It's a special type of protein called an enzyme, and its number one job is to break down the carbs you eat, things like bread and pasta, into simple sugars that your body can actually use for fuel. And it's made in two main places, your salivary glands, which is why digestion literally starts in your mouth, and, crucially, your pancreas.
And you know what? It's totally normal and actually healthy to have a little bit of this amylase floating around in your blood and urine. So this test isn't about if you have amylase, but rather how much you have. We're just checking to see if that amount is in the right range.
So that brings us to the why. Out of all the things they could test for, why would your doctor zero in on this one enzyme? Well, it's all about connecting the dots between how you're feeling and the science of what's happening inside.
Your doctor is kind of like a detective, and when they suspect something might be up with your pancreas, checking your amylase level is one of their first biggest clues. So what symptoms are they looking for that point them in that direction?
Well, if you're dealing with something like a nagging pain in your upper stomach, maybe one that even feels like it's spreading to your back, and especially if that pain flares up right after you eat, that's a huge flag. You add things like nausea, a fever, or any of these other symptoms on the list, and your doctor is very likely going to want to check your amylase to see if a pancreas issue, like pancreatitis, is the culprit.
But here's something you might not know. It's not just about finding a new problem. The amylase test is also a really valuable tool for keeping an eye on certain long-term health conditions and seeing if treatments are actually working. And wow, just look at this list. It shows you the incredible range of what this test can help monitor. We're talking about everything from chronic pancreatitis to checking in on someone's recovery after they've had gallstones removed. It really gives doctors a vital window into how the pancreas is doing over time.
Okay, let's switch gears and talk about the practical stuff. Your doctor says you need the test, so what's actually going to happen when you go in? So there are a few ways to get this done. By far the most common is a simple blood test. They just take a small sample from a vein in your arm, and the whole thing is usually over in less than 5 minutes. A urine test is also pretty common, and then, in some pretty specific cases, they might test the fluid directly from the abdomen, but that one is much less frequent. Now, if you are doing a urine test, getting what's called a clean catch is absolutely essential for getting an accurate result. It's just a simple method to make sure that no germs from your skin get into the sample. Seriously, just following these steps carefully is the most important part.
Getting ready for the test is super easy, but you've got to follow the instructions for the results to be right. The big things are no alcohol for 24 hours before, and you might need to avoid eating for a couple of hours before a blood test. And this part is crucial. Tell your provider about every single medication you take. But please, don't stop taking anything unless they specifically tell you to do so.
And what about risks? Well, here's the good news. For the standard blood and urine tests, the risk is incredibly low. With a blood draw, you might get a little pinch or a small bruise that fades quickly, but that's really it. In a urine test, no known risks at all.
Okay, the moment of truth. You've done the test, and now you have a report with some numbers on it. Let's break down what those numbers might actually be telling us.
So you can think of it like this. The results can go high or they can go low, and each one tells a different kind of story. Really high levels often mean something sudden is happening, like an acute attack of pancreatitis or a blockage. On the other hand, unusually low levels might point to more long-term damage to the pancreas, or they could be linked to other issues like kidney disease.
Now, this is so important to remember. A number on a lab report is not a diagnosis. It's just one clue. Your doctor is going to take this number and look at it alongside your symptoms, your history, and other tests to figure out what's really going on. It's just one piece of a much bigger puzzle.
All right, so you've got your number. What's next? Where do we go from here? Let's look at the final steps in this process.
And that brings up a really great question. Is this test the end of the road for the investigation, or is it just the first stop?
Well, the answer is it's almost always part of a team effort.
It's very likely your provider will also order something called a lipase test. Lipase is another enzyme your pancreas makes, and testing for both amylase and lipase together gives a much clearer, more accurate picture of what's happening, especially for diagnosing pancreatitis.
So, if you take away just one thing from all of this, let it be this. An amylase test gives us really important data, but it's the conversation you have with your healthcare provider that turns that data into answers. They are the only ones who can put all the pieces together and tell you what it all means for you and your health. So with that in mind, what's one question you'll be sure to ask your doctor about your results?